69 gross peleke examination of the abdominal part 1. Base to your fingernails. So I have already washed my hands, but supposed to follow the antiseptic technique. So good afternoon, sir. I'm Leah K. Gross, second year medical student from the Medical School Foundation. And I am tasked to examine the abdominal area. Is it okay for you, sir?
Yes.
May I know your name?
Windale Gross.
Sir Windale, how old are you?
I am 15 years old.
You are from?
Barangay Carpenter, Nagal City.
Your civil status and your occupation?
Single and a high school student.
Your religion?
Roman Catholic.
Okay, so Sir Windale, for this afternoon again, I am tasked to do the examination of the abdominal area. So this includes inspection, auscultation, palpation, and percussion. And this is important, especially for patients who complains of abdominal pain or discomfort, associated symptoms like diarrhea, nausea, and vomiting, or any pain that they could feel on the abdominal area, and so on. So is it okay for you if we would start?
Yes.
Okay. So first is we have to tell the patient to lie down in a supine position with the pillow on their head and then pillow on their knee area. And then we open up. Is it okay? Can you please place your hands on the sides? We open up the abdominal area from the sternal going to the inguinal. Okay, and then we now proceed to, then we drape the patient and then we proceed to inspection. So in inspection, we have to check for the general appearance of the abdominal area. So for our patients, I don't see any rashes, no erythema, inflammation, or no dilated veins, and the shape is color brown. Then check for the symmetry. Okay, so for the so it's symmetrical and it's flat. Then can you please sit up, sir? Check for abdominal wall mass. Okay, there is none. Back. Then we proceed to auscultation. So we start to auscultate before percuss and palpate so that we could not touch the pain in the abdominal area if there are any pain, and then there are no differences when we proceed to the next examination procedures. So we also auscultate using the diaphragm of our stethoscope to hear the bowel sounds, which is a clicks with a frequency of 5 to 34 per minute, so that's normal. And we use the bell of the stethoscope for listening to bruits, if there are any. So bruits is like a heart sounds, murmur heart sounds. So this suggests any vascular occlusive diseases or carcinoma. Okay, so we auscultate with a systemic root from the right upper quadrant going to the right lower quadrant. Okay. No for brutes. Okay, then we proceed to percussion. So in percussion we distinguish the difference of a timpani and a dullness sound. So timpani is usually heard all over the abdominal area because of the gas in the GIT tract, and dullness is heard if there is any fluid or if there is the organ present. So again, we percuss with the systemic root from the right upper to the right lower quadrant. Then we percuss the liver edge. So we start down below so that we would hear the transition from tympani to dullness. Okay, then uh, we percuss now the dome of the liver from above so that we would hear the difference of the transition from resonance to dullness. Okay, so here. Then we also percuss for the spleen, which is on the left mid axillary from the 6th to the 10th rib. Okay, so then we percuss the left subcostal areas going to the epigastric. Okay, so then we proceed to palpation. So on palpation, we palpate from light touches to deep touches. Okay, so we use the palm of our hands, and then we feel for any tenderness. Then we ask the patient if the patient feel any pain while palpate. So we start from the right upper to going to the right lower. Do you feel any pain?
No.
I will apply deep touch po ha. Feel any pain?
No po.
Okay, then we palpate for the liver edge. So we support with our left. Okay, sige lang sir. Left hand. You feel any pain?
No.
Okay, for the gallbladder, which is just below the liver margin. Feel any pain?
No.
For the spleen. Sige lang sir, relax lang po. Feel any pain?
No.
Then go for the kidneys, the left and the right kidney. Feel any pain?
No.
Feel any pain?
No.
And then the abdominal aorta. Feel any pain?
No.
Okay. So then we check for abdominal reflexes if the abdominal muscles are responsive to the reflex. Okay, relax lang sir ah. Okay. Okay, then last we do the kidney punch. Can you please sit up, sir? So we percuss the costovertebral angles of the kidneys of the right and the left. Okay. Do you feel any pain?
No.
Okay, no. So that concludes our abdominal examination. So, sir, Sir Windale, your examination results are normal. So, the abdominal wall or the abdomen is symmetrical. It's also flat. There's no rashes or erythematous, and no striations also. And the liver is around 7 centimeters on the lower margin, on the lower right or the right side, and no hepatosplenomegaly. Also, the kidneys are not felt, and then no extra bowel sounds. So they're just normal. I hear clicks. Okay, and then um, for the kidney punch, so you don't feel any pain, so it's normal. Your kidneys are also well because we did not palpate any palpable muscles in the abdominal area. Okay, do you feel, do you have any questions?
None.
Okay, so if there is problems that you will feel with your abdominal area, just don't hesitate to come back here. Okay? Okay, thank you so much for your preparation.